Prior to a rotator cuff repair surgery, I think it's very important to, again, have a long discussion with the patients about the expected recovery after surgery as well as the anticipated outcomes. It's a very long, difficult, painful road to recovery, and preparing ourselves for that is of the utmost importance. Specifically, I try to prepare them in the early phases for how we're going to manage the pain, and so we set up a multimodal pain management strategy in advance of surgery, talking about what narcotics may be helpful, what other medicines we'll prescribe, sleep arrangements to sleep in a more upright position, which may help control some of the pain. Again, assistance at home, as we're going to now take away your shoulder for a little bit, your arm for a little bit with a specialized sling for the first 4 to 6 weeks. All trying to prepare you for success in the short term, as well as prepare your mind for the recovery process over the next 6 to 9 months.